So, good morning, everybody. And again, I want to thank the essential employees, the people working at our hospitals, the people that are keeping government moving and keeping in businesses moving and doing it in a safe manner. Thank you as always. We can't do it without you. Unfortunately, today marks the 50th day since our first case. And I was thinking, wow, where did the 50 days go by? But that's why I want to remind everyone at home, it's a marathon, it's not a sprint. Take a step back, take a deep breath. It's going to be a while. It's going to be a while. And unfortunately, sadly, we had 3 more Albany County residents pass away last night, which brings our total up to 44. And my condolences, my prayers, my thoughts go out to the family, to all the other 41 families. It's a difficult time that they're going through, and it's difficult even more when you lose a loved one. We had one male in his 70s that was a resident of our nursing home at Shaker Place that passed away, and we had 2 females in their 80s that passed away. That brings our total at Shaker Place up to 4 people that passed away. And again, to the workers out there, my heart goes out to you, to the families, because they feel this just as much as the family because of the care that they're giving them day in and day out. So. Again, these are difficult times, and when you look around and it's a new world out there and it's different than it was 50 days ago, think of other people around you. And that's why Dr. Whalen and I continue to say, please social distance, please wear your mask when you're out in public, and we can get through this. And we'll get through this because we're New Yorkers and we get through things. We're resilient, and we need to be together as one in a partnership. So today we have 1,151 positive cases for the coronavirus, up 31 from yesterday. We have 1,004 people under mandatory quarantine. That's up 97 from yesterday. And we have 14 people under precautionary quarantine, and that's down 8 from yesterday. At Shaker Place, like I said, unfortunately, we had one of our residents pass away, but we've been aggressively testing out there. Obviously, since the beginning, we locked it down earlier than any other nursing home before the governor called on it and put protocols in place. But it's hard to stop. We've had 46 residents that tested positive. Out of the 46, 2 have recovered, and we have 25 employees that tested positive, and 7 have recovered and are back to work out of the 25. We have 2,348 people that have completed quarantine, and 578 who tested positive for the coronavirus have recovered. We have 33 people in the hospital with a hospitalization rate of 2.8, and that's down 1 from yesterday. We have 8 people in our ICU. That's down 2 from yesterday. We had 10 yesterday. Again, as we aggressively are out there testing at UAlbany, at our mobile test sites, at Rite Aid, you're going to see these numbers decline. We've been aggressive, but the only way we're going to reopen up is get a true number, get the true way of mapping and tracing everything, and that's how we have to do this, working together. I do want to remind people that please, I know everyone wants to get tested. You need signs and symptoms. I know Dr. Whalen put that out, and I'll always let her tell you what you should be looking for. But the reality is, I know there's people that have got multiple tests because they think they get it. You just can't go, I know your anxiety is up, but I'm actually take a deep breath and leave what tests are out there for people that need to get tested. I've heard from multiple people, well, I got tested again. I'm like, you shouldn't have gotten tested the first time, but I'm not a doctor, so I'm not going to judge that. But please think about the people that need to get this test. So until we get more testing kits, until we can make this more available to everyone, we have to address the people that have signs and symptoms. So again, I do want to say thank you, and don't forget about our site in Gilliland at Urgent Care that we opened up. But more importantly, it's great to have I have to go through two mics because Senator Gillibrand's on the other one. It's great to have our New York State Senator, Kristen Gillibrand, on Zoom. So she's been working really hard with Senator Schumer and Congressman Tonko in D.C., always having our back, out there working hard to get a stimulus money. And I can't thank her and her staff enough for what they do, constantly reaching out and calling us. Ashley gave me a call over the weekend to make sure I was doing okay. Senator, I appreciate that, and caught me off guard. And she's just like, hey, just call and see how you're doing and how you're holding up. And it really meant a lot. And working with you and your team means a lot. And I'm going to let you take over, Senator. So, Senator Gillibrand.
Thank you, Mr. County Executive, for your leadership. Thank you for doing these briefings. They are very helpful to Albany residents. People like to have facts and information, and it does create a sense of calmness and less fear because they know what they're up against and know what's happening. So thank you for taking the time to do this. I also want to recognize our Health Commissioner, Dr. Elizabeth Whalen, for her leadership, for her enormous dedication to serving our communities. It really matters, and I'm grateful for all the sacrifices you're making. For Albany County residents, it's obviously been a tough time. You've been particularly hit hard in your nursing homes, our older populations. And one thing I know about Albany residents is we are resilient. We are very strong. We don't give up, and we certainly don't give in. And what's been most inspiring over the last few months is just the number of people who have sacrificed on behalf of others. Our first responders, our nurses, our EMTs, our doctors, our home health aides, our health workers, our grocery store clerks, our pharmacy clerks, everyone who is working to make sure critical businesses and critical work is being done. And those are the people that really remind us that there's nothing we can't overcome. And we will overcome this virus. We will defeat this virus. The good news is we are slowly but surely getting more money into our communities through these COVID packages. We've been able to get, most recently, another $75 billion into our hospitals. We were not able to get money for counties and cities and states, which was a huge disappointment, but we are working very hard to make sure that's in the next package. We have been working to help basically the most at-risk, at-need issues, sending money to small businesses. The first tranche of small business money got sucked up really fast by the bigger players who had relationships with big banks, who had existing SBA loans. They took the lion's share of that money. So the second tranche of SBA money, we tried to put in to help smaller businesses. And most recently, we restricted all money could only go to entities that have only $1 billion or less of savings or business in their banks. So that's going to go to more credit unions, more community banks, more banks that serve Albany. So that's good news. We also gave resources to large businesses that goes through Mnuchin and Treasury. That seems to be doing well. It's just a loan facility for very, large businesses. We sent money immediately for unemployment. The obvious rise of unemployment is pretty crippling. 26 million people is a lot of people. We expect to see much more. So we sent out unemployment checks for 4 months to anyone who's unemployed. And we did a little top up of $600, which again is a small amount of money, but we're trying to help people survive this. And it's not nearly enough for people, but it's enough hopefully to keep food on the table and to keep the lights on. So we are going to keep working on getting more resources. For the COVID-4 package that we're working on right now, I have a lot of priorities, and I'll tell you a little bit what I'm working on to give you a sense of what we're trying to accomplish in the next package. First and foremost, we want to have sick days. We literally don't have sick days for some of these critical workers that are going to work every day. You look at the people who work in the grocery stores, they might not have sick days, and they have to show up if they want to earn a living, and they are critical workers, and to not have sick days is absurd. So we want universal sick days. Our second bill we passed only had sick days for 25% of workers, and we want that to be 100. We want to have more money for paid leave. We should have national paid leave. If we had it in place, we would have been able to tell every worker in America, if you need to stay home because your kid's at home, if you need to stay home because you're sick or a loved one's sick, you are still employed, you're still getting your insurance, your health insurance, but you can take 3 months off. We could have funded that fund, and it would have been so much easier than what we're having to cobble together now with UI and other benefits. So I want national paid leave. And if we have it, it will be able to be the safety net that deals with any crisis like this in the future. And it really shows that we didn't have it. Again, our second bill only covered about 25% of those workers. We need 100%. I want to make sure we can meet the needs of our healthcare workers. And so one thing that we know, if we want to get our economy up and running, if we want to get kids back to school, we really need to increase testing. And so in the last package, we put $25 billion in for testing. And so what I want to create is a health force, basically like a AmeriCorps for healthcare. And what that would look like is we would train 1 million workers over the next 2 months to be the ones who do testing, who do contact tracing, and eventually when we have vaccines, to do vaccines. So that's the purpose of this health force. And I think it's something that could change the trajectory of this disease, because once you can test every kid before they go back to school, you can send your kids and not worry. If you can test any kid who has a fever, just like we do strep tests and we do flu tests, it will be very easy to trace that, figure out who's been exposed, and again, lock it down. You want to be able to be very rapid in your analysis of who's been exposed once we open back up. Otherwise, you're just going to have another huge increase of the number of people exposed to COVID. And we're going to be stuck with it until there's a vaccine, which is about a year away. So I think this health force could be game changing. I also want to deal with some of the economic inequality that's really become obvious through this crisis. We've seen that COVID disproportionately affects communities of color. We've seen it in Albany. And unfortunately, what that is because of is lots of decades of institutional racism and other factors that affect people's health. So, not having access to healthcare or having less healthcare, not having access to clean air, clean water, not having access to safe and appropriate housing. So one thing I want to change is access to capital. One of the toughest things for low-income Americans is they don't have savings accounts or checking accounts. They can't get a small loan. They can't get a business loan. They can't get a mortgage. So we want to create postal banking. Now, the reason why this helps low-income families is they can have a set savings, checking, and can get microloans. Imagine being able to get a loan for $500 to pay that heating bill that you couldn't afford, or to pay a car payment or a car repair, unexpected health condition, unexpected medical costs. It would make a difference. And the post offices used to do that. They used to do it in the turn of the century, and they did it straight through the 1960s. And so if we can open that back up again, we have 30,000 post offices in the country. They want resources, they need resources, and they're going to go out of business by this summer if we don't do something. And I want those post offices to be up and running for elections, because I think if we're still with COVID, which is most likely, we want to be able to allow people to vote by mail. And we want every voter to be able to be mailed an absentee ballot in advance, so that if they do not feel they can safely go and vote, they can actually fill out an absentee ballot and send it in. We also want flexibility, like early voting and curbside voting, so that we can spread out the vote as much as we can. So again, people don't have to risk getting COVID just to go vote. So that provision I hope gets in there. And then more money to make sure our elections are secure. The last few packages didn't have any money for hunger relief, or not enough money for hunger relief. It was a little bit in the beginning. And what we heard from our food banks in Albany County and across the state is the need is much greater, because so many more people are unemployed and less people have money to actually donate. So we need more resources going in to stop hunger in this country. It's outrageous that we cannot make sure kids don't go to bed hungry. So we're hoping to include money for food stamps as well in the next bill. So there's a lot of work to do. I feel that our jobs have changed quite a bit in that I spend my day, almost my whole day, on conference calls, on Zoom calls, phone calls, talking to our stakeholders, talking to New Yorkers about how their lives have so radically changed and what their needs are. And I can tell you, our first responders, our not-for-profits, our food banks, our homeless shelters, our domestic violence shelters, they're working overtime to serve the most at need and at risk right now. So we are going to get to work. We are going to keep fighting for more money. We want to make sure state and local money is included in this next package because our state didn't get nearly enough to close the budget holes. I've talked to your county exec. Your budget holes will be in the millions. And so each county exec will need money to plug those holes, as will our mayors and as will our governor. So we're hoping that the next package can have significant resources for cities and states and counties. And that's what I've been working on with Senator Schumer, and Senator Schumer has been an extraordinary leader in this. I can't tell you how hard he's worked to get more resources into our state. And I'm just working with him to make sure I lift up the voices of all our stakeholders across the state so he knows exactly who needs what and what's working and what's not working. So thank you for the opportunity, Mr. County Executive, to address this briefing. I'm grateful you have it every day, and just let me know what I can do for you in the future.
Thank you, Senator Gillibrand, and I appreciate your time. I know you got a lot on your plate. Thank you for fighting for not just the residents of Albany County, but the Capital District and all of New Yorkers. And we can't have a better champion than you in DC fighting this fight to get us the money for, like you brought up some great points with hunger and small businesses, which we're hearing about. So thank you. I do appreciate it. I know you can't, we're hoping you're going to be able to take time to answer questions, but I know you got to go with another conference call. But
yeah, the next time you have a briefing that you want me to join, I will make more time.
I appreciate that. And again, thank you for your time. Thank you.
God bless. Take care.
Dr. Whalen, would you like to say it?
Good morning, everybody. I also would like to thank Senator Gillibrand for her support and for her tireless work to advance so many important public responses to this public health crisis. In particular, I would like to thank her for recognizing the work of our Department of Health. We do employ a small army of contact tracers that have been responsible thus far for doing the investigation on every case that has been reported in Albany County. This includes phone follow-up, contact tracing, home visits, and following along until people are released from isolation or quarantine. It's been exhaustive work at the health department, and we continue to do that. It is true that this is an unprecedented volume of work. We have never been as involved in a disease outbreak that is as has as many cases and is as prolonged as this. And we know we are still at the beginning. As the county executive indicated, it's day 50. For a lot of us, it feels like it's been a lot longer than that. And I understand that sentiment is common in the general public too, and really harkens back to the notion that we all have to work together to get through this. I wanted to talk a little bit about the amount of increased cases we're seeing. If you follow the trends along, you'll see that this week we had a spike in positive cases in Albany County. Many of these cases are the result of widespread testing that has been implemented when we have cases either in our nursing homes or in our long-term care facilities. We have been working very close with the New York State Department of Health to ensure that a wide spectrum of workers and residents are tested when we note positive cases. As I've talked about in the past, this helps us identify those that are working in these facilities that may be infected with COVID-19 but may not be aware of this. So we have seen an expansion in criteria for testing to allow essential workers, particularly workers that work with high needs and high risk populations, like those in nursing homes and long-term care facilities, that are now being told that they can test some asymptomatic workers. So we believe that this is an important strategy. As we have done these widespread tests, the test results that we get back, we are finding a higher rate than expected of asymptomatic infections in these places. And it really harkens again back to the importance of doing what you can when you're not at work to mitigate the spread of COVID-19. And as I said yesterday, if you're someone that lives with an essential worker, you have a job to do too, which is to keep COVID out of your home so that your family members are not infected that are caring for the general public. We do believe that these agencies are doing their best to prevent infection in their facilities. There is meticulous screening of workers coming in. Workers have been masked. Facilities have been closed to visitation. But we know again that this is a highly contagious disease. So we have to make sure that we have strategies in place that can broaden the testing capacity and make sure that we can box this in. So when we find out people are positive, we can tell people to stay home. And that group of individuals who are caring for high needs, high risk individuals are going to be a particular focus of concern. We received additional guidance from the state on this, and we look forward to following this along so that these tragic deaths that we have to report on a daily basis become a thing of the past. We want to protect our most vulnerable population. We're learning about this disease every single day. What's the most important thing to do is to learn from these lessons as rapidly as possible and to continue to study the data so that we can make data-informed decisions that are based on science, decisions that will help stem the flow. As from day one, testing is key. It's key in this, because if we cannot identify infections, we cannot implement the appropriate control measures that we need to prevent spread. So again, I'd like to commend the county executive for the tireless work that he's done to bring testing to Albany County, to ensure that residents that need to be tested have a place that they can go to be tested. This has made a big difference. We need to continue this strategy going forward, and we need to be able to expand testing strategy. As Senator Gillibrand just discussed, there are many scenarios that we could utilize testing to be able to create more assurances in the community, to be able to ensure that people who are working are better protected going back. A single COVID-19 test only tells you if you are infected with COVID-19. For those that are not working with high-risk people in the community, for those that are home, for those that have very limited social interaction, we don't recommend testing for asymptomatic people. But we would like to see the availability of testing expand so that we can ensure that those that are working with this at-risk population can be tested when they have had contact, when there is a risk in their facilities, and particularly looking at individuals that may work in multiple different facilities to make sure that those individuals are doing everything that they can to prevent spread in the places that they work with multiple at-risk individuals. So this is, again, something that we are putting a lens on now, and we are working very closely with our partners at State DOH. This is something that we have been, from day one, concerned about, and as we see these cases start to tick up, we need to be more aggressive. We need to be more proactive with how we prevent these things from occurring in the future and following emerging guidance along. So I look forward to continuing that essential work and spreading the message every single day of the importance of social isolation, of hand washing, and not reporting to work if you feel even minor symptoms. Contact your doctor, contact your local health department, contact us, and we can assist you if you have minor symptoms that you're concerned about, where you can go to be tested. Thank you.
Thank you, Dr. Whalen, as always. And one of the things that I want to work on right away was when we decided to close our nursing home down before anyone else did it, so we stopped people from coming in, was setting up virtual visits so important. And I first and foremost want to say thank you to the staff, because a lot of staff out there have taken their time and have used their own phones to call the person they're taking care of, their loved ones or their family, to let them see them via FaceTime or just hear their voice. So we've been working on this, and as of today, we have set up virtual visits, so the families now can make arrangements, and they can see their loved ones, and they can talk to them, and have that reassurance that they are getting the best quality care. So to the families and to the residents and to the workers out there, thank you as always, and I look forward to the first person that will be able to kind of Skype a little bit with their loved ones and talk to them. So that's going to be awesome. But also, I want to remind everyone too, the mental health line is always set up 7 days a week, 8 a.m. to 8 p.m. The number, as always, is 518-269-6634, and the 211 number in New York State hotline. Again, people, remember, it's a marathon, not a sprint. Times changed, and we have to change with the times. So again, thank you.